Thank you for coming, and thank you for supporting the hospital. Your presence means a lot to all of us here. It's tough, really, to talk about mental health and the challenges related to mental health in 15 minutes. I'll give it a shot, but I'm going to be flying really quickly through things, and I'm open for questions at the end of the talk. So, unlike my colleagues, men and women have the same organ up here. And so I'm going to be talking about our precious brains and about the differences between men and women as far as mental health and mental illness is concerned. When it comes to mental health, the sexes are definitely different. Mental illness affects both, obviously, sexes, but it affects men very differently from women. Men don't talk about illness the way women do. And this evening, we're going to talk. Recognizing the signs that someone may have a mental illness is the first step to living a better life and obviously getting treatment. So, why does this difference actually matter? Well, it matters because mental health problems are amongst the most common and burdensome issues related to disability worldwide. Gender differences exist even when socioeconomic gradients are controlled for. So things like, even when you control for things like socioeconomic status in education, disadvantaged populations, there's still significant differences men to women. For example, never married or single, separated or divorced men have a much higher incidence of mental health hospitalizations than the same group of women. The converse, married women have a very high incidence of admissions to hospital, and men don't. I don't know why, but that's what happens. Men get married, and women start getting hospitalized. I don't get it. But it's a fact. Overlooking gender difference can have severe consequences. Because even in medicine, there are gender stereotypes. Even in medicine, physician colleagues will see women and their emotionality as somewhat synchronous, and men and their alcohol and substance use problems are somewhat synchronous. And sometimes we attribute things to those conditions in a kind of unfair, biased kind of way because of stereotypy. And as a result, these difficulties, get kind of overlooked. Mental illness affects 1 in 5 Canadians. That's a significant and staggering statistic. And it's been shown through research there are different characteristics between men and women. Women tend to internalize, so women tend to swallow their frustrations and their emotionality. They tend to be internalizers, and this internalization causes withdrawal and loneliness and depression. They're verbal, but they internalize. Men, on the other hand, tend to externalize emotions, which can lead to aggression. It can lead to irritability, coercive behaviors, non-compliant behaviors, and this finding causes us to have different approaches in treatment to externalizers and internalizers. There are major differences in help in seeking behaviors in men and women. Men, for example, are less willing to talk about their difficulties. There are social norms that they have to live up to that disallow this, and they're very prone to downplaying their symptoms. So this evening, I'm going to try to go over some of the big, it's impossible to cover psychiatry in 10 minutes, but I'm going to go over some of the big categories, these 6 or 7 categories. And I'll touch on each of them briefly just to educate you on some of the basics so that you understand some of the challenges. Depression in men is often undiagnosed. It's a leading cause of disability worldwide now, and male depression goes unrecognized and undiagnosed. And that's a real big problem. Men are more likely to report things like fatigue and irritability and a loss of joy or ability to extract joy from life, rather than the typical feelings of worthlessness or sadness or hopelessness that is commoner when women present. And sometimes as a result, physicians will miss diagnosing depression or chasing symptoms to make that diagnosis. And this is true as well for anxiety disorders. Bipolar disorders, so bipolar illness is two poles. So you have people who have illnesses where their moods are unstable at two ends. They're unstable at the top end, so they flip out the roof and they flip out the floor. And so they have profound depressions and they have manic and hypomanic bursts of sustained elation, bizarre behavior, high energy that lasts for days, weeks on end, and is very, very disruptive. So people with mood instability at two poles are called people with bipolar illness. And interestingly, this is probably the only major mental disorder, but there's no difference between the sexes. Men and women are equally affected, and usually the onset's between the age of 16 and 25. Schizophrenia and psychosis, very disabling condition, very common and very disabling, and triggered by many, many different things. But this is a leading cause of disability now, and the vast majority of people diagnosed with schizophrenia under the age of 30 are men. In some studies, up to 90% are men. And that is quite astounding, but that's the new normal in the diagnosis of schizophrenia and psychosis. It's a fairly staggering number. We don't think of eating disorders when we think about men, but interestingly, 10% of the population that suffers from an eating disorder are men with bulimia and anorexia. And there's this new condition, we have something called a DSM, it's a diagnostic manual for psychiatry. And there's a new diagnosis now called binge eating disorder. I won't go over the details, but 35% of patients in this category are men, which is interesting. And it's rare for us to see a man with an eating disorder in our program. Men just don't seek help for eating disorders. Substance abuse. 1 in 5 Canadian men develop alcohol dependence. Staggering in their lifetime. That's a big number. Gay and bisexual men have a higher incidence of substance use disorder. And male veterans, regardless of their form of service experience twice the rate of substance abuse compared to female veterans. We don't quite know why, but there may be some normative variables between these two groups. And speaking of veterans, there's a condition called PTSD, and men and women. So PTSD is post-traumatic stress disorder. You've probably heard of it. And it's a condition, it's a kind of anxiety disorder. It's a condition that's triggered by witnessing a violent or life-threatening life event, such as war, but it can also be triggered by trauma that's emotional, related to abuse, physical, sexual, emotional trauma in a person's life. And this PTSD transforms people. They relive these experiences and are transformed into distrustful, continually on guard, with vivid, horrible nightmares, emotional alcohol to cope. It's a big trigger for substance usage. I want to touch briefly on the most humbling part of my job, which is suicide. In Canada, we lose 10 people every day to suicide. And that is just tragic. Male suicides have been rising in this country since the year 2000. And it is the leading cause of death in our youth now. It's caught up to traffic accidents in young people. Our First Nations populations have 6 times the rate of suicide as the general population, and our Inuit populations have 11 times the rate of the general population. This is becoming a public health nightmare. And you probably read about it in the newspaper and news reports, because it does get unfortunately, a lot of press. In the US, and this translates to Canada as well, the risk is stratified into two big groups. White men over the age of 85 and men in general under the age of 35 are high-risk people. And in this, under the 35-year group, it's a leading cause of death. So you can see that suicide is a really destructive variable in North America now. There are other areas that are non-mental health related that contribute significantly to suicide, where individuals may not be mentally ill, but have suffered a sudden loss or job loss, or have been faced with some other emotional hardship, social isolation, or military-related trauma, and sometimes genetics. There's a strong genetic load in suicide that runs in families, and there are often families that we see where individuals have sequentially, unfortunately, taken their own lives. So, given what we've learned, there are significant things we need to know about men. They turn more red. Number one is that they turn more readily to drugs and alcohol. They act out their feelings a lot more commonly, and they're less likely to talk. And they have a higher rate and a higher risk of suicide. I can't really go over all of the details of the warning signs, but suffice it to say that everything I list has to be for a protracted period of time, not for a day or an hour. So typically, 2 or 3 weeks continuously of these symptom loads, and these become warning signs. And the ones that are listed there are anger and irritability, mood changes that are persistent, energy changes that are persistent, appetite changes, either too much eating or too little eating or no eating, sleep changes, either too little or too much, concentration changes that result in functional failure in school or at work, job performance issues that are consistent and worsening, unrelenting anxiety, edginess and worry, alcohol and drug use, suicidal thoughts that we touched on, not being able to feel positive. If this is sustained, if you're not able to extract joy from life and it's sustained, that's really problematic and worth getting checked out. People who are not able to experience positive emotionality are obviously at higher risk of developing a syndrome of depression. Obsessive thinking, high-risk behaviors that I think Dr. Monavari alluded to earlier. High-risk behaviors are particularly seen in the bipolar population, who are risk takers, or even in people who really don't value their lives as much, with things like PTSD, or even sometimes in the young depressed male. Ongoing body symptoms such as unresolving headaches, or body pain that's generalized, or digestive systems that don't seem to go away, or unusual thoughts, bizarre thinking where you're hearing voices, or just, your thoughts don't feel connected to reality, are all, warning signs of the possibility of an underlying major mental disorder. So men and women are definitely different. We're different in the way we experience life and the way our brains and our bodies process the difference and process our experiences. So don't be afraid to ask for help. It's a strength to ask for help, not a weakness. And if you ask, we'll be there. Collectively, we must empower, normalize, and destigmatize mental illness. And I thank you for listening.